warahmatullahi wabarakatuh. Hello, my name is Shavira Kusuma Wardani from S1 Nursing Department, Universitas Muhammadiyah Ponorogo. In this video, I will to explain about material vital signs. Okay, keep the watching this video and enjoy. The vital signs consist of blood pressure, pulse, respiration rate, and body temperature. There are two advantages to measuring vital signs during the initial examination. First, the determination of the baseline normal can ensure a standard comparison when emergency occurring during treatment. If emergency occurs, patient knowledge of normal value is important to determine the severity of the problem. For example, if a patient loses consciousness unexpectedly and his blood pressure is 90.50 mm/Hg, the attention will certainly be different in a patient whose normal blood pressure is 115.265 mm/Hg compared to patient with hypertension who has a normal blood pressure of 180.2 to 110 mm/Hg. In the second instance, a patient who is in shock may be fine. The second benefit is to identify both diagnosed and undiagnosed abnormality. For example, a patient with uncontrolled severe hypertension who is not identified and has not received good management will be very dangerous. The purpose of this examination is only detect to make a diagnosis. If there are findings of significant abnormalities, the patient should be referred to a doctor for further evaluation. Sort of vital signs are 1. Blood pressure. The purpose of blood pressure check is to determine the presence of normal tension, hypertension, or hypotension. Blood pressure is measured by indirect examination of the upper extremity with a blood pressure message and a stethoscope. The message must be the correct width for accurate measurement. Ideally, the pocket in the cuff should cover 80% of circumference of the arm, with the center of the back over the brachial artery. The standard cuff width for an average adult arm is 12 to 14 cm. Cuff links that are too small give a higher yield, where cuffs that are too large produce a value that is smaller than the true value. The radial artery can be palpated so that only the mean systolic value can be measured. Instruments that measure blood pressure on the wrist are fringier and gaining in popularity. However, they are under-recommended because of their potentially inaccurate. The stethoscope must be of a good standard, well, and is more used for auscultation of the brachial artery. However, the use of a diaphragm is more commonly used and acceptable. Second, pulse. The standard procedure of checking the pulse is palpate the carotid artery at the edge of the trachea or the radial artery on the thumb side of the arm. The use of the carotid artery for pulse measurement has several advantages. First, the carotid artery is quite familiar because most dentists receive training in cardiopulmonary resuscitation (CPR). Second, this artery is quite representative because it is the main artery that supplies the brain, especially in emergency situations. This artery can be palpated while other peripheral artery cannot be palpated. Finally, the artery is easy to palpate because of its size. 3. Respiration rate. Respiration rate purpose to assess the frequency of breathing. Technique. The operator stands behind the patient and without the knowledge of the patient is subject to chest count observation. Count the number of chest count movement. Cycle of the inspiratory and expiratory passage in 1 minute. Interpretation. Normal respiration rate baby are 24 to 30 cycles per minute. Children are 20 to 24 cycles per minute. Adult cats and young adults are 12 to 18 cycles per minute. Adults are 8 to 12 cycles per minute. 4. Body temperature. Purpose to determine the patient's body temperature. Technique. Using variety of body temperature calibers. Thermometer. Adjust for the instrument used. Interpretation. Normal adult body temperature is 36 degrees Celsius. And then subfibris 37 degrees Celsius. And then fibris proof 38 degrees Celsius. Okay. I think that is all I can say explain about this material vital signs. I hope you have benefit from the watching this video. Okay, thank you for your watching and goodbye. Wassalamualaikum warahmatullahi wabarakatuh.